Well, good afternoon, everyone. Welcome to today's webinar, HR Strategy from COVID and Beyond. This is part two of a four-part series. I think you saw the next two seminars announced in the slides, one in February and one in April. So we've got a lot of content coming your way and the way of the community and the chamber. It's presented by our Chamber's Human Resource and Professional Development Committee that's led by Tammy Davidson, who is the EVP from Right Management Florida Caribbean, who chairs the HR committee, and Aaron Tandy, vice chair of the committee, who is a partner at Pathum Shermer Tandy LLP. Thank you both for your incredible leadership of this very important committee in a very important time. We have been very impressed. We have a very impressive panel of experts, a good friend of mine from Ryder, who you'll hear from, and it's great to see him again around the chamber haunts. And we're going to hear about topics surrounding COVID and how it's changed the HR function, today's HR expectations in general of all of you as professionals, and hear a little bit about the tools that you can access to become much more effective in your HR role and implementing your HR strategies. So we're going to get to a message from our sponsors, and they're extremely important, but I want to first go over some of the webinar logistics, so how things run. I'm sure all of you are used to it by now, but it always bears mentioning. First of all, you'll notice that everybody's microphones are muted. We do have a chat box that we have open, and that's there for you to utilize to network with each other, to exchange ideas, make any comments, share information. It's really there for interaction. If you have a question for the speakers in the panel, make sure that you use the Q&A function at the bottom, because that is where our staff behind the scenes is looking to float your questions up to the panel and our moderator. So please use the Q&A box for your questions, and for interactions, use the chat box. Also, keep an eye on there because staff may be dropping in links to information and other things that you may want to look at later. So the webinar, as you see, is being recorded, and it'll be available later on our chamber website. And of course, you know, this is chamber property, and none of it can be reproduced or used without the express written consent from the chamber. Okay, so those are the rules of engagement. Let's go to talk a little bit about our sponsors. You know, sponsorship makes the world go around. It makes it possible for us to provide these instructive webinars to all of our members and to the community at large. So we're really, really very grateful to the sponsors. And today's sponsor is BIU University. Let's watch a video quickly here.
We live in a world that is constantly changing, a challenging, complex world that requires us to be better and better. That is why BIU University, from its headquarters in Florida, United States, prepares you not only with the necessary knowledge to be a successful professional in the areas of business, education, and technology, but also offers you tools to develop your soft skills, which are the key differentiator sought by companies today. Through our 100% online methodology, based on learning by doing and through the analysis of real and current case studies, you will be able to discover, identify, and lead the path to success. Because we want to accompany you to become the best version of yourself. Broward International University. Be limitless. Be successful. Member of the International Higher Education Network.
Planeta Formación y Universidades.
Thank you to Broward International University for that sponsorship and that wonderful message. Okay, so now without further ado, let me turn it over to our chair and vice chair of the Chamber's Human Resource and Professional Development Committee, Tammy and Aaron. Take it away.
I am here. Thank you, Alfred. And thank you all for joining us today. I am Tammy Davidson. I'm the EVP and Client Services of Right Management. And I'm going to take 30 seconds. If you don't know me, okay, I want to know you. All right. I want to get connected with you on LinkedIn. I want to make sure that we are an active force in this community. And at Right Management, you know, we do talent solutions. We do executive coaching and outplacement and have many things to help your businesses. And I know that my friends here online are great sponsors of our work, and we appreciate that. Also, with this committee, it's not just Aaron and I. It is a team of HR professionals that work very diligently and very hard to get these things and programs done. If you want to join our committee, please do so. Please contact me. Please contact Aaron. Please contact the chamber, because we need all the wonderful expertise and help we can have. Now, I will tell you, you have to be a chamber member, and Alfred is always after me to make that plug, but I will tell you it's not that expensive and you can do it. And you're going to hear from people that have been chamber members for a long time today. With this committee, we wouldn't be able to do everything without our backup plans here. We thank Leanne and we thank the rest of the chamber for making this possible. And without further ado, Aaron, will you introduce our wonderful panel moderator?
I would love to. So as everybody said, this is our second of 4 webinars that our committee has put together to be informative programs to help elevate the HR professionals and make a difference in your organizations. You're going to hear from a wonderful group of people today, but it wouldn't have been possible without our moderator, Pilar Proctor, Senior HR Consultant at Proctor Global Management. So I want to say thank you already to Pilar for putting this together, helping the panelists to hone their message, and hopefully you'll take away some great key ideas that you can incorporate in your practices and in your organizations. So thank you for attending. Thank you to our sponsor, Broward International University. Thank you to Tammy and Leanne, and thank you to the rest of our committee. And with that, Pilar, I turn the program over to you. Thank you.
Hello, everybody. Thank you so much. Thank you, Tammy. Thank you, Aaron, and welcome everybody to our webinar number 2 from our series of HR strategy. I want to thank our panelists. My name is Pilar Proctor. I'm the Senior HR Advisor for Proctor Global Management Services, where we try to avoid an HR mess for our clients. I want to introduce our panelists. First of all, we have Frank Lopez, Executive Vice President and Chief Human Resources Officer at Ryder Shipping and Logistics and Transportation. Victoria Toffey, Chief Human Resources Officer at Amerijet International Air Shipping and Transportation. And Margie Vargas, Senior Vice President and Chief Human Resources Officer at Memorial Healthcare Systems Medical. We want to thank you for your time and for donating your expertise and your experience with us. This is, as I mentioned, webinar number 2. For those of you in the audience that attended webinar number 1, you will see the flow and how we continue digging a little bit deeper into some of the ideas and the concepts that we brought. For those of you who are attending this for the first time, we encourage you to go to the link and review the previous recording, and you will see how the link how it connects the ideas. I've always wanted to say previously on episode 1, we're going to give you a quick recap of what we covered in episode webinar number 1. We had a definitional conversation about what it is the HR strategy, the expectations, the skills, the competencies of the HR business partner today, the metrics, the justification for the investment on some of the programs that we have. And we talked about how we responded to COVID. And that is the idea that we're going to develop further and a little bit deeper today. And the second idea that we're going to develop is how the HR function continues to evolve and continues to transform from a reactive to a proactive business partner in the organization. So our premise is that the COVID crisis catapulted the HR function to the middle of the strategic business decision-making table. HR reacted promptly and responded to the needs of the organization, collaborating with management. At the beginning of the crisis, nobody knew what to do, but everybody ran to HR. And the first question was, what do we do? And the first answer was, I don't know, but we'll figure it out. And figure out we did. And we managed just about all aspects of the employer-employee relationship, all at the same time. Mental health, legal compliance, work environment, safety, medical information, remote work, policies, procedures, performance. I'm surprised that we haven't taken a 3-week nap. We are all exhausted by now. And if there is anything positive that we can say about COVID, is that it illustrated the value of the alignment of an effective business strategy with an HR strategy. Those organizations that clearly had an alignment of the HR strategy with the business strategy had a better chance to respond faster, to survive, and at times even thrive during the COVID crisis. Now the question is, now what? Now that the COVID is behind us, where are we as an HR function? Are we still in the reactive? How do we become more proactive? And how do we stay as a value-added member, as a strategic decision-making level in the organization? So those are the 2 ideas that we're going to develop with our panelists. And again, thank you, Frank, thank you, Victoria, and thank you, Margie, for your time. The first question that I have, and we're going to go first with Victoria and then Frank and then Margie. Let's just start with the storytelling. Share with us, please, what is your COVID story? How did COVID transform the HR function in general as you see it, and specifically in your organization? How did the HR function respond during and after COVID? What were some of the success stories or perhaps some of the lessons learned that you can share with us? Victoria?
Sure, that's a heavy question. So I don't just have one COVID story, I have stories. So at the start of the pandemic, I was working in HR for the cruise industry, and everybody knows how impacted the cruise industry was from COVID. So we were blindsided. We didn't have a playbook at the time. And you're right, everybody looked to HR for, okay, what are we doing? And I like to say that HR got a promotion due to COVID, because I really do think it has elevated the HR function to be front and center and to be a trusted advisor to the business on what are we going to do. And at the beginning of the pandemic, it really started trickling in with, we are a global company. We had people, employees all over the world, and every country was different at the time. And we had initially just started looking at, okay, where can we travel to, and where are our employees located, and how do we respond to those that are ill, and what are the CDC guidelines, what are they saying? And it was all over the map at the time, right? And pulling a team together, a task force to work through those early issues and develop policies and procedures that never existed. After we figured out the travel issues and locking down travel, getting our employees home safely, then it was, okay, how do we maintain and continue the business? So what's the business continuity plan, and how can HR support the business? So we got into the creating policies. The number one was, what's the remote work policy, and how can we leverage technology to ensure we're connected and the business can continue to function in all of the uncertainty that we have. So that was the early story. And then I left the cruise industry and ended up going to be head of HR for Piper Aircraft, which is located in Vero Beach. It's a manufacturing company, so much different. So that story, when I entered there, it was all about safety and health and continuing the business. You can't manufacture an airplane from home. So who can work from home? Who is an essential worker? And how do we keep those employees safe and maintain the business? Avoiding layoffs, keeping the business successful and running. So again, I led a task force at Piper, and it included safety, legal, HR, business, to make those key decisions and keep the business functioning and thriving in the pandemic. So early on, we partnered with a local provider to get the vaccines on site and get early access to vaccine for our employees that were interested. But we met almost daily as a task force, because you really had to be agile and make quick decisions. And again, HR had to take the forefront and have a perspective and bring the different areas together to make decisions that were right for the business. And what I learned is every business is different. And there are priorities that exist. And the key for HR is to understand the business and what the business needs to thrive. And now I just recently started as Chief HR Officer of Amerijet International Airlines. I've been here 3 months, so my story is just beginning here. So I've talked enough. Let me pass it on to one of my co-panelists.
Thank you. Frank?
Yes, thank you, Pilar, and thank you all for having me. I would say that there's so much to talk about in this subject, as Victoria mentioned.
That's why we dedicated one webinar just for that.
But if I can leave you, kind of my COVID story, our COVID story started, is like all of us, right? As you're reading the news and you're seeing what's going on and you're thinking, wow, there's this thing called a pandemic. And the first thing I did was, well, what do we do in this, in this pandemic? And then I remembered, being at Ryder, we're, a lot of engineers, a lot of logistics people. We like to be very, very prepared. Everybody has a playbook for something or some document to follow that somebody has created. So I remember thinking, well, have we ever prepared for a pandemic? And then I remembered, well, we had the bird flu, like, over a decade or so ago that everybody prepared. And I kept having this huge binder in my office that I kept saying, I'm going to throw away at one point because we're never going to have a bird flu. So I remember going back thankfully I had this thing and it's this huge binder. And I thought to myself, well, all my answers have to be in this book then, right? Well, the book was completely useless, as you might imagine. The pandemic for COVID was unlike anything that we've ever had. And I think the COVID story for so many people is that there was no playbook. There was no answer for us. And it really leaned upon, for HR and for leaders, on what we have been talking about for so long, right, as leaders, is learning and agility, right? And this was exactly that. We were going to learn as we go. We were going to make mistakes and we were going to pivot. But I think for any organization, and for ours in particular, is, when you're dealing with uncertainty or ambiguity, which we all are, right? And even in the normal business course, you are. This is just in a much more heightened perspective, is you have to lean on your values as an organization. I think that's why it's so important when we're talking about what are the values of any organization. Why it's so important is because when you are in areas of uncertainty, that is what grounds you. And for us, being in the transportation industry, safety is a core component of our business, because we put trucks on the road. Not only do we want to ensure that our employees come back safely, but we want to make sure that we're safe for the driving public. So because that was a core value for us, it helped guide a lot of the decision making. If you think about it, the biggest challenge a challenge we never dealt with, or anybody, was there's so many challenges in the workplace, but we never thought we'd have a challenge where employees were afraid to come to work, right? That was a new one for us. And so by focusing on what we knew was a core value, and we displayed it to our employees knew. We have a motto at Ryder for being captain of the ship. You are responsible for, if something is not safe, you shouldn't do it, and you have the complete backing of management. So by relying on safety as a core value, helped guide us and helped lead us to those answers as we went through this process, right, of dealing with COVID. So I think that the lesson learned for us is that you don't have to have all the answers always, and that not having the answers, but if you have your core values and you lean on your own agility and your ability to drive change within an organization, you will be successful, and you'll find those answers, like a lot of us did in that. And that is the learning going forward, I think, for HR and for all business leaders, is that we are a lot more agile than we gave ourselves credit for. So if you think about in the past on how we dealt with change, or a new product or a new service or some challenge from a customer perspective, I think pre-COVID, a lot of us put together focus groups, did pilots. We're very slow to drive change, even though we thought we were fast. Fast was what happened during COVID, when we had to pivot at speeds that we never had to do in the past. And I think that's a muscle that we exercised, that I think is the learning going forward coming out of COVID, is we are a lot more agile than we gave ourselves credit for. And now we need to continue to exercise that as we deal with whatever the new set of challenges are in the future.
And I will have a question about that in a minute. Thank you very much, Margie.
Hi, good afternoon, everyone. Thanks for having me. Thanks for including in the invitation to participate today. I work for Memorial Healthcare System, and it's 14,000 employees in South Broward County. And our charge is to just take care of the community. And so the importance of HR at this organization came to the forefront immediately, right? Taking care of our employees so that they can take care of the communities. And very similar to what Victoria has mentioned and Frank has mentioned just now, pivoting was a muscle that we had no choice but to rely on almost immediately. CDC said one thing at 1 o'clock, and by 3 o'clock it was something else. And so being able to support our workforce that was taking care of the community at the most fragile time in history became daunting. You know, our first COVID patient showed up on March 7th, and we thought, okay, well, our EDs will be impacted. Let's see how that goes. And in a matter of 2 weeks, we were in just chaos that you can't describe. So our charge became keep moving HR strategy forward, but at the same time, start identifying what are those needs for our employees. And those needs became very much about mental health support. It became about the person, not necessarily health benefits, but how do we deploy immediately to the front lines that level of support, mental health, spiritual support, you name it. And so a lot of those initiatives are still in play. You know, we are an industry in the delivery of healthcare that we don't really rely on virtual and a virtual space. And again, having to try to pivot as much as we could to telemedicine, and those that were not charged with touching the patient and delivering care, how to move them very, very quickly into a virtual work arrangement. So a lot of those initiatives are things that we wanted to do, but they were not an organizational priority. And overnight, they were the priority. And I think back, and it's amazing to me how, regardless of industry, how we've been able to survive and learn lots of lessons in the last 2.5 years, soon to be 3.
Absolutely, yeah. It's sounds like a dream, right? Like how you dream about a machine. And this drives us to a little bit more into our second question. Because as we mentioned, some of the industries were affected in different ways, right? The IT industry, there's a what? Doesn't matter, I'm still remote. I don't really worry about that. But right now we have represented here the healthcare industry and the logistics and transportation industry. So I want to dig a little bit deeper. What were your top 3 priorities? And I heard safety and I heard mental health, but what were your top 3 priorities? And you said everything else can fall, but these 3 things are absolute top. And we're going to start with Margie and then Frank and then
Victoria. Sure. That's a great question. I think for us, it was employee safety and keeping our employees safe and healthy as much as possible. So that was one priority. Number 2, supply chain. I think we have all been touched by what has happened to supply chain worldwide. For us, it became a life or death situation with, you know, how do we obtain the necessary tools, equipment to safeguard our staff? You know, N95 masks were a premium. And so again, you know, supply and demand, supply chain, and number 3, that now has become number 1 for us is, you know, again, that mental health support for our staff. You know, we had, I'll give you an example. In one of our heavy hit facilities, in just one shift, there were over 20 patients that passed. So think of the impact of our caregivers having cardiac arrest, blue alerts called moment after moment as patients were passing. So it was about finding the muscle, even if you were not a therapist, figuring out how to be empathetic, caring, and support someone that was experiencing something that they never thought they would ever experience as a health provider. And so those 3 imperatives for us were safety, but all kinds of safety: physical safety, health safety, emotional safety, and just finding the tools. Yeah.
Frank, you're on mute.
You know, in a different way, not so much. I mean, you know, I think from Margie's standpoint, they're providing service to the community and the health needs, and they're an essential part of the workforce. For us, we were essential in a different way, and that is because we provided a lot of the supply chains to ensure, to help our economy keep going, to help employees as they stayed home, to make sure that they had their groceries and they had the items and the things that they needed to keep moving this economy forward. So while many in certain sectors able to work remote, a lot, a huge percentage of our 45,000 employees are warehouse workers, drivers, mechanics that don't have that luxury, right? And we're essential in order to, ensure that we kept this economy going. So for us, the three areas that we, to answer your question, three areas. Number one is absolutely safety, right? We had to ensure that we could keep operating this business. And the only way to keep operating the business to deliver to our customers was to make sure that we provided a safe environment for them through either PPE equipment, through support from their managers, through time off to get vaccines, time off for COVID, all the policies, everything that we had to set up. Because, in many ways, we would also have a shift where somebody got COVID, 5 other people got COVID, we'd have to shut down an entire operation. A lot of these operations, if you think about it, are supporting CPG companies that are delivering toilet paper. So there's a run of toilet paper. Well, our warehouses were running 3 shifts, 24 hours a day. And we knew we were if one person got COVID and it got spread, our safety policies required us to close, to clean the facility, to do all that. So we were hyper sensitive to try to get as much safety, not only because it was the right thing for our employees, but also to continue our business continuity for our business. So safety was a huge concern. But I think as you moved on, safety was kind of foundational. But an area that we started also to focus on our priority was engagement. And the reason is because people were worn out. They were tired. They felt like they couldn't do it anymore. And then how do you engage folks? How do you keep them, right? I mean, yeah, we provided bonuses and opportunities because there were parts of our business that, like in the restaurant and automotive parts that we did supply chains that really had severe cutbacks. In the CPG sectors and health and tech and healthcare, a lot of that business just tripled overnight. So we were thriving in other areas. There were times where we would be able to provide as much economic, incentives, but that wasn't enough, right? I think employees were just worn out. And how do you keep them engaged? How do you provide that work-life balance for them so that we can continue? Because we also knew that there was going to be a back end to this, right? How do you retain that top talent, right? Because the first initial reaction, and many of you recall, was how many layoffs are we going to do? Like, we have to lay off everybody. Okay, if you're in corporate or you were in some back office function and you're not touching a customer, we're going to do, we're going to put people on layoff. And that quickly went from, oh no, I think we're going to need these people. How do we compensate? How do we engage them? How do we ensure when we come on the back end? And then the other part was a business standpoint. And there's an area where HR can play is we have to balance, right, what we're trying to do for our employees, but what are the business implications for this, right? I have organizations, I have certain parts of our business that were shut down completely. I know that we couldn't just retain all the employees. There was no way to afford that, but there was a balance between understanding how to do that but making sure that those employees would return when we needed them, and putting on that business hat as an HR person to understand, because it's very easy to just say, well, we got to keep everybody. Well, we know that we can't do that in all circumstances. And that I think is where HR can help drive that balance between
absolutely. And that drives the idea of the alignment of the HR strategy with the business strategy. Victoria.
Very similar priorities. I would say number one was safety and health. And then overall well-being became a close second. And then I'll just mention the third was really communication, because there was so much concern out there about what does this mean for me and my family, my job security. We very early on instituted monthly town halls and constant communication to update folks on what was changing. I think it was Margie who mentioned how the CDC changed like almost within a couple hours, and we were trying to keep up with that and communicate and give folks the opportunity to ask questions and get real-time answers from leadership. So that was a huge priority, communication. For the overall well-being, I'll add that we enhanced our EAP. We worked with our provider and we added online counseling via text, audio, and chat or video. And that proved very successful. We also enhanced the number of sessions to help provide support to the employees. And it's actually a fourth priority, though I'm going over, because Frank mentioned engagement, and that was something that we did as well. Is we implemented a new engagement survey to really listen to employees and develop a listening strategy on what, how they were feeling and what was important to them, because it was really hard to get everybody to agree. I recall getting some anonymous letters from employees, from one side or the other, that if you're going to mandate vaccines, we're going to quit, or the opposite. Yeah. So it's really relying on your values and as a company communicating why and educating the employees, because you can't please everybody, and you just have to make a decision and stick with it, communicate and educate.
Absolutely, thank you. And I will have that getting controversial or political. I will have a question on vaccination policy. So we have evolved. So what are the expectations now today from the HR function in general? We're going to start with Victoria and Margie. And how do you elaborate on some of the specific competencies that we now need to develop? How do we justify the investment on this type of developmental opportunities for the HR function, for your HR teams? And what have you implemented today? Competencies like business acumen, financial knowledge, things that before COVID were, would be good to have, but today is like, we must have it. How do we justify having those programs to develop as a return investment of metrics or KPIs? Victoria.
Sure. So I would use the term trusted advisor as the key descriptor of HR during and post pandemic. I've spent a lot of time evaluating competencies and creating a success profile for HR. And some of the competencies that I truly value is consulting agility, I would call it. And by consulting agility, it's having that business acumen and financial acumen, understanding how the business makes money and how HR can support the business to continue making money in all different times. Change leadership is critical. We had to constantly pivot, so having the capability to lead change initiatives, have a talent perspective on all facets of the business and how talent can contribute. Also, I would say operations knowledge, again, understanding how the business operates and what challenges the business has that HR can support with HR initiatives. And then lastly, enterprise thinking or systems thinking. So not looking at just one area of the business, having the capability and the competency to see the whole picture and develop strategies based on the whole enterprise.
Absolutely. Margie?
So I'm going to say ditto.
All of the above.
Yeah, for sure. I think that what it has done for us is that we were and we now are even a greater business partner. Partnering with the business is so much bigger than the technical aspects of the delivery of HR services. And so as we are in this COVID recovery, the afterlife of whatever this looks like for us as a business, we have to change our strategy. So, entering strategic planning on the HR side is really tied, connected hand in hand with the organizational strategy, being able to pivot, revamping, reevaluating what the employee value proposition is and developing strategies around that. So truly helping our HR practitioners, our business partners develop muscles in other areas such as succession planning, workforce development and planning, analytics, being able to understand the data and using it in a predictive manner. People, caregivers this is no secret. They've left the healthcare space. People have been tired, they're frustrated for a host of reasons. And COVID brought a lot of opportunities for caregivers that they didn't have before. So our competitors are not just hospital systems. And so how do we create our own career development pipeline strategy, succession planning strategies to be able to retain talent, grow it, retain it, and partnering with other health systems that are suffering from the same exact problems, challenges today. So all of those muscles are a little bit different than what we needed to have in play prior to 2020. Spending a lot of energy in that space.
Okay, Frank?
So yeah, I agree with Margie and Victoria wholeheartedly. I mean, my advice to any HR business partner out there is, if there's one that you want to focus on that I think could help you become a much more valued partner, is being a change leader. Change is hard. The business needs help and change. And if you think about what we just went through, right? And often we relied on HR to help us drive that change. So take that skill set, develop it even further, and you can lean on with your business partners to be the leader of that change, and using that experience that you have, continuing in all aspects of the business. Because if you think about it, regardless of what you're trying to change, it always starts with a human, and it's always about a behavior. And that's an area where you can always have a voice. And if you do that, I guarantee you business leaders will be extremely ecstatic, because a lot of people don't like change, and they struggle with how to drive the change. And that's an area where you can have a huge impact.
Absolutely. Thank you. I'm going to have one more question, and then after that, Leanne, we're just going to pick one or two questions. I'm looking at the time, so maybe depending on that, we may actually just jump into the next one. I'm looking at the time and respect everybody's time. So now, without getting into politics or controversial topics as it is, but we started mentioning the vaccination policies. So if you can just let us know what your vaccination policy requirements were, the rationale, any implications thus far, do we need to prepare for answering questions, etc. And again, we're not going to get into any legal aspects. Our next webinar, one of our webinars, will drill into a lot of legal questions about that, but just very quickly in general. And we have Frank, please, Margie, and then Victoria.
Yeah, so in our business, we did not require vaccinations. We suggested it, we recommended it, but we did not have a mandate. There are some areas where we had to, because where we operate on site at a customer location, and the customer, where we're providing services on site, they're looking at, if the customer had a vaccine mandate, then we had to follow that. But at a general policy provider, we did not mandate vaccines.
Okay.
So we did require it, but we were caught. We did require it, but there was no loss of employment. We worked with employees on, the whole process of religious accommodations and medical accommodations, you name it. But we got caught in the middle of two huge bodies, which is our CMS, Centers for Medicare and Medicaid, which again, we are a participating health provider, right? So funding comes from the federal government, and then the state of Florida. So we've been in that precarious space since Florida legislation came through that prohibited, mandating the vaccine. So case in point, I mean, at the end of the day, our employees did what they felt was best for them. And we did end up with a 90% plus vaccination rate. But the other 10% or so that did not, for a variety of reasons, we respected that and kept our workforce intact.
Okay, Victoria.
We did not require or mandate vaccinations. We did highly encourage, and we did a series on educating and myth busting what people were hearing, you know, out on social media. We actually brought in a doctor of, gosh, I can't remember his title, what he was, but he was highly experienced and knowledgeable. And he did a lunch and learn for employees to attend to answer questions. And that proved highly impactful. And it did increase folks willing to get the vaccination.
Mhm.
And we had on-site clinic available to do the vaccine after that education session. So it did prove successful, but we did not mandate it.
And it very much depended on the industry, right? And the location,
Yes.
the type of business that we had. So we've been talking about the before and after COVID and how COVID affected all of us and changed, everybody changed the HR function. As we continue to evolve, and the question that I would have for you is, has HR as a function truly evolved and transformed from a reactive to a proactive role? Now that we are not at a crisis level with COVID, how will the HR business partner remain at the strategic decision-making table? Or are we going to be back like before COVID, like in many organizations? We still hear the stories today where HR seems to be the last one to find out about business decisions. We still hear that, oh, there's a business meeting and the head of HR receives a call that says, oh, by the way, we're going to expand operations in this region. We need to hire 10 more people. Can we start interviewing tomorrow? And HR is like caught like a deer in the headlights. So how do we evolve? How do we change from a reactive to a proactive role to continue to be a participant, strategic advisor role in the business? And start with Margie.
Well, I will say I'm super fortunate in that the presidents, we've had 3 presidents at Memorial over a 40+ year period of time. So I would say I'm very fortunate in that executive leadership there's been continuity, but HR has always sat at the table. So I will say that that for me is critical to the role that I play, and that human resources sits at the table. We are participating in business strategy. We're participating in visioning and what the future of this organization looks like. And that's been something that has kept a lot of my team here, is that I know that doesn't exist and it's almost an anomaly. So I wish I could weigh in the pre and the post, but I'm fortunate in that pre and post HR has been at the table.
Frank?
Yeah, so I mean, similar to Margie, I'm fortunate that I am in an organization where we are heavily involved in the business with our CEO and all of our division presidents. But I still think, I'll tell you, it doesn't happen everywhere, right? Even within our entire organization, right? I know I have certain HR business partners in certain areas of our business that are saying, well, how can I be more of a strategic business partner? I find out after the fact, or my colleague over here doesn't do that or do that. And the advice that I give a lot of more junior or younger people as they're moving up through the organization is a few things. Is one, seek to understand before you want to be understood. Because I think a lot of folks immediately come into an HR role and say, well, the business doesn't want to hear me. Well, I always ask, well, do you know what the business wants? Right? I mean, because a lot of times you just want to go in there, you have this, I know, a desire to add value, but do you truly understand? Right? So I tell people first, build that relationship, right? Get to know your business partner, deliver on the things you have to deliver. You have to be known as somebody that can be counted on to perform the work that's being asked of you, first and foremost. And number 2, ask a lot of questions, be curious, learn, have the business acumen, be part of the understanding and that curiosity around the business, and then ask questions, right? I think that's the most powerful way of this thing. You say, hey, I understand that you have this concern. Have you thought about this? Or what do you think about this? And then find what you think are the gaps in the business, and help close them. So there's ways of bringing yourself to the table. So somebody doesn't have to, remember, it's not, you don't want to get to the table because somebody's being told that they have to bring you. You want to get to the table because you've earned it, right? And the way you earn it is by building that relationship, being curious and unlearning the business and showing that you can add value.
Thank you, Victoria.
Yes, that was very well said by both Frank and Margie. So, I mean, I would just add that it all starts from the business objectives. What is the business trying to achieve? Is it high growth? Is it, cost cutting? Where is the business at? What are those objectives? And then make sure the HR strategic objectives align with the business objectives. And it all starts with understanding them. And like Frank said, being curious and making sure you understand. I like to operate with 3 to 5 HR strategic objectives that align with the business. And then once you have those strategic objectives, every initiative in HR should tie to one of those, I like to call them strategic pillars. And if it doesn't, then you need to realign and make sure you're doing work that is of value to the business strategy. And then every business is different. I think every HR department needs to show the ROI. There should be an HR dashboard that measures those metrics that are important to delivering the strategy. And if you're sharing those at the business leadership level, like Frank said, you're not going to have to ask to be brought in. They're going to want you there to tell the story, show the perspectives that HR is valuing and how they're delivering and helping to meet the business objectives. So I think that's where it all starts.
Thank you. And that brings one of the questions that I'm going to skip, but it was just on how do we test that this newly gained recognition is acknowledged and valued by the business. It's more of instead of pushing in before COVID, is being pulled in by the business, right? That's really where we want to get to that point where, no, wait, we can't start a meeting because HR is not here kind of question. Thank you so much. One last question, because I'm looking at the time, almost as if we had a crystal ball, of course. How will the HR function in your organization continue to evolve? And what do you anticipate will be the top 3 priorities for the HR function as we recover now, before and after COVID? What has been a permanent change that you can say before COVID we were or we were not, after COVID we are or we're not? What are some of the future challenges that the HR business partner needs to anticipate today, talking about being proactive regarding talent acquisition, diversity, compliance, this economic recession? And last question, what would be, and I think Frank started approaching this, what would be your advice to the HR business partner today on how to approach the CEO or the business decision makers to illustrate why HR should remain as a proactive strategic business partner? And if we can start with Margie, then Frank, then Victoria, and then we'll go to some questions.
Sure. So I jotted down a couple notes because I think that we're in a prime space. We're in a prime space to really reimagine the delivery of care. And by reimagining the delivery of care, we need to reimagine what future workforce looks like. Because there's a lot of healthcare that is being provided outside the bricks and mortars of our hospitals. And so that leads to that conversation that once we have a sense of what that looks like, and it's evolving very quickly, how do we attract talent and how do we build that pipeline in an industry where it's not very appealing right now for a host of reasons? Fatigue, inability to practice at top of license or top of profession due to lots of regulatory and compliance and just noise in the environment. But if we're going to be able to survive what this looks like, we have to define both future work and the future workforce. So that's a priority that it's something that actually keeps me up at night. What does that look like for us,
I
right?
love to question.
Yeah, exactly, because it's about partnerships. So partnerships with, our academic community, partnership with our community stakeholders. We've been talking about, do we ignite a fire for a desire to be a caregiver as early as, elementary, middle school? So it's changing how we've done that work. The second piece that's equally as important is really understanding what the employee value proposition needs to look like. And it has to be fluid. Back in the day, we would establish, okay, these are the things that are going to attract talent and keep talent at the organization. And clearly, COVID has taught us that we have to be nimble and that it has to be a very fluid strategy. So those two things are critically important. In terms of words of advice of approaching a CEO, approaching your executive council or executive staff at your organization, I always find that, the proof is in the pudding. What do you contribute? How are you going to contribute? And really discovering best practices outside of your industry. So not pigeonholing yourself in my world, it's important to know what other healthcare competitors are doing, but it's more important for me to know what Frank is doing. It's more important for me to know what Victoria is doing that works in their space, because our workforce is going to come from other industries, not necessarily just healthcare.
Absolutely. Victoria?
Yeah, so I read an article recently that talked about the old and the future, and it was interesting because they said this is way back before the pandemic. It was a loyalty contract. So people joined organizations because they provided pay and benefits and job security. Then pre-pandemic, we moved into an engagement contract where people stayed with companies that they felt happy with, and they had intrinsic motivation to stay there, also paying benefits. But then now it's a lifestyle contract. Does this job fit my lifestyle? Can I have the healthy work environment, the psychological safety, the well-being, a flexible schedule, whether I want to work remote, hybrid, or want to be in person? So that's now the contract of the future, and where we have to adapt to meet the needs of future employees. And I know we're getting to the end and we want to leave some time, but my advice would be to speak with data. That's what business leaders want to hear is tell the HR story with data and stay on top of trends. And the HR community is a great community. I've networked and benchmarked with several colleagues throughout the pandemic. And again, that's invaluable.
Absolutely. Frank?
Right. Yeah, no, I know we're at the end here. I agree everything that Victoria and Margie said. If I could just focus on one thing what Victoria just said is data. Business folks talk with numbers, with data. HR people, the more comfortable you get about analyzing data, and when I say data, is don't just give a report out of data. Anybody can read data, right? It's can you analyze data? Can you find the gaps in the data? Can you find where you think that there's a problem based on your reading of the data? Because that's that people get confused. And don't just report the news, right? I want you to analyze it and tell me what you think the data shows about what actions we should take. And the world, that's where the world is going, right? With everything. And if you think about in our space for an HR, with the amount of advent with new HR systems and the technologies that exist today, that is becoming a lot easier for you. But that would be my recommendation.
Absolutely. And that should cascade all the way, because there was a question that we had in our previous webinar that said, yeah, what about those of us that are just doing the administrative side of HR? But that administrative side, you're managing the data, you're looking at retention, you're looking at statistics, you're looking at demographics. There's a lot. And if you don't think that data is valuable, question, why am I doing this? What's the point for this? Where is this connected to the company? To how are we making money? How much are we making money? Why? Great. Thank you so much. Do we have time? I don't think we have time for questions. Leanne?
We only had one question, and
Okay, good.
that was from Tammy, and she stated, "What is next for HR with this?"
Okay, well, anybody wants to take that? What's the next? The crystal ball for HR. Data? Margie, Victoria, Frank?
Well,
I want someone to sell me that crystal ball.
Exactly, we're looking for that.
Listen, that I think Victoria was talking about it. I think the relationship between the employer and the employee has changed dramatically. And I'm not sure if ever is going to go back to the way it was pre-COVID. Employees are much more, have a sense of entitlement about what it is that they expect and they want from the employer. And they're not willing to compromise as much as they probably were willing to balance it before. So I think that's a new challenge and a reality we all have to face.
Absolutely. We like to say that the roles have reversed, that candidates are interviewing companies, not companies interviewing candidates, right?
Right.
Alrighty. Tammy, thank you so much. We are
Yep.
at a little bit on the time. Thank you again, Frank and Victoria and Margie, for your time and sharing your expertise. Tammy, I'll leave it back to you. Thank you.
Wonderful. Well, Frank, Victoria, and Margie, thank you so much. When I called you to ask you to do this, you said, gosh, I'll hold that date. That was about 6 weeks ago. And now we are looking for a storm that's coming towards us in our beautiful state. And we know that the HR phone is going to ring off the hook if it hasn't already been ringing off the hook, because the first line of defense is HR. So thank you for your service to the community today. Really appreciate that. And I want to thank all the people at Right Management that support me. They are behind me 100%. And thank you for letting me be the chairman of this committee. It's terrific. The next event, okay, is going to be in February, and you don't want to miss it. It's going to be HR Talent Solutions, and we're going to have a dynamic panel, and we're going to have a wonderful moderator. So write it down. And I'm going to encourage everyone here to get on our committee and help us do what we need to do. I want to thank BIU for their sponsorship today. Thank you for that. And thank you to the Chamber and Alfred for always being a partner of mine and Rights and standing behind us and what we do. So with that, everyone, stay safe, protect your loved ones, and blessings.
Thank you, everybody.